Prescription for Health. I have my host here, Tucker. He is co-hosting from heaven. So if you don't know who Tucker is, he just passed away this past February, and he was my heart and soul. So now he is working from heaven, and he's helping me do my live stream. Tucker. I'm going to move it because actually his little mirror glares on my glasses. So he's right here. All right, you guys. If you have questions for Tucker and I, please ask away. This is your chance to ask medical questions. I'm a family practice physician. I'll try to answer them as best as I can. I've been in practice for 27 years, and it's been a great ride. I could tell you stories. I'm sure if you have questions about that, let me know. But if you are here for the first time, please hit that thumbs up or the like button or the heart. I'm live on YouTube and Instagram at the moment. So we'll see how we do over there on YouTube. But you guys over on Instagram, I appreciate it. I see all you guys waving. Let me know where you're listening from. Yesterday I had a lot of different countries. That was great. So Kathy and Aso and Elaine, thank you for joining. Sheila says, can you talk about H. pylori? What question do you have in regards to H. pylori? H. pylori is a bacteria. It loves to grow in our stomach. It likes to cause havoc in our stomach. It is an overgrowth because our biome is unhealthy. So let me know what questions you have in regards to athletic rehab. Thanks for joining. I appreciate it. So we'll kind of wait here for Sheila to ask. Oh, the doc is requesting that you take antibiotics. Well, do you have, hi Diane from San Diego, do you have symptoms? Why would you simply take an antibiotic if you do not have symptoms? Antibiotics can cause more problems. So it's kind of, you know, that's going to be a decision that you and your doctor make. But, you know, H. pylori does not go away. Okay, for your friend Sheila. Yeah, H. pylori does not go away. It remains positive forever, even if you've treated it. So if you treat it, it will, the testing can always be positive. If you're not having symptoms, I don't necessarily think I would take antibiotics, but again, that is up to your friend. So had a question here. Are you a doctor? Yes, I just got done talking about that. I'm a family practice physician. I'm located in Iowa. Been practiced for 27 years. Sheila says her doc wants her to, she does not want to take it. I wonder if it should be treated. Again, there's more questions that need to be answered and what else is going on. If she's got H. pylori, she's likely got other things that are going on. So these things need to be looked into. All right. Okay. I do get a lot, my elbows sticking to my papers, my notes. I get a lot of questions on skincare. Good morning, Mom. There's my mom. My mom just joined on Instagram. So if you guys see her, say hello. She just gave me a wave. Good morning, Mom. I'm glad to see you here. So we'll talk a little bit about skincare because I get questions in those regards on a regular basis, specifically acne, sometimes rosacea. And I want to be perfectly clear. Your acne, your rosacea is not caused by a lack of something. It's not caused by a lack of skincare. It's not caused by a lack of LED light. It's not caused by a lack of dermabrasion or dermal fillers or Botox or whatever the salicylic acid, BHAs and AHAs. Your acne or your rosacea is not the cause, and you need to look deeper. And so that's where I wanted to kind of chime in that regard is, what are we doing about the main cause? Your diet. The diet is likely the main cause of your skin condition, whether it be rosacea or keratosis pilaris or acne. You got to turn to what is going on with your diet. One of the culprits, and I mentioned this yesterday, in our diet is lectins. lectins are a type of protein that are bound with a type of carbohydrate. Oh yeah, I forgot to mention eczema. Yeah, eczema is in that category. Anything that we have that radiates or is present on our skin is likely radiating from something inside. And usually the usual culprit is something we are eating, usually on a regular basis. Have a friend who's suffering from eczema, conventional therapy, everything conventional with no relief. Well, sooner, I'm sure, knowing you've probably dug into their diet, but like I say, I'll just kind of talk a little bit about lectins, and I mentioned it yesterday, lectins, lectins. They are a type of protein. They are found in grains and legumes and nightshade plants, just to name a few, okay? So lectins have a carbohydrate bound to them. They're a protein with a carbohydrate bound to them. They increase gut permeability. What does that mean? That means it causes leaky gut. So for somebody who says, you know, there's no such thing as leaky gut, then how do you explain gap junctions? How do you explain the permeability that's going on? The enterocytes that line the intestinal lining become irritated, become inflamed, and they can start separating. They're supposed to be very tight, and a gap junction can occur when our enterocytes don't sit next to each other. Okay, they're not sitting in tight patterns, in tight junctions. They're called gap junctions. And so one of the things that increases gap junctions or increases that possibility is lectins, or even wheat agglutinin I mentioned yesterday. They cause permeability. And when we start leaking stuff from the inside to the outside of our intestinal lining, we start getting problems. And some of those problems are skin problems. So when we fix our diet, remove lectins, remove wheat germ agglutinin, so basically you're removing grains. And then if you're going to remove all lectins, you're going to remove most plants, because nuts are in that group. Nightshade plants like tomatoes, peppers, all of those, yeah, gone, because they have lectins. There's a lot of, even chicken has lectins. So we have to be very cautious on what we're consuming, because that's a problem. Now, a lot of people will say, well, that's caused, that, you know, the leaky gut is a cause of autoimmune disorders. Is that possible? Yeah. But what's an autoimmune? I mean, were we born to have our cells actually attacked by antibodies? You know, I go back and forth on this. Is Hashimoto's really antibodies to our our normal cells? I do go in deep on, you know, I go back and forth. And I'm not saying I'm flip-flopping. I'm still on a learning curve when it comes to autoimmune. And I think that's good for me to admit that, because I don't want to be set in stone on something I really don't know enough about. But there are some in some schools of thought will say that whenever we have leaky gut and we have permeability, we're causing autoimmune issues. Is it the autoimmune issue and we're producing antibodies, or is it the underlying problems, you know, the underlying diet? And so my idea for you guys, if you have these problems, like on your skin or something like that, is to do an elimination diet. All right? Doing an elimination diet looks like maybe meat, salt, and water. And maybe you do that for 2-3 months, say 90 days. And then you start adding in one food at a time, and then you might be able to pick up what is the cause or the culprit of your condition, in this case, your skin condition. Acne, rosacea, eczema, okay, psoriasis, all of those are inflammatory reactions from something else going on inside, okay? So elimination diet is number one. Now, what about devices like LEDs? You know, I might flip-flop, but many of you have asked about LED masks, and I don't work for any particular company. Olux has one, Dr. Rajani, Rajani. There's one by StylePro that's even more affordable, but let me see. an LED mask looks something like this. Like this is an Olux, okay? And it has LED lights that are in a pattern. And LED light, this particular LED light are in red and near infrared. Those are the two main wavelengths that we are getting in a mask. Now, some masks also have blue light, and blue light is great for acne because blue light will basically, it basically attacks a porphyrin in a bacteria that's causing the acne. So acne is caused by a bacterium, right? And then the blue light, because of how it penetrates, it will attack a special protein in the bacterium and wipe them out. It causes though, a reactive oxygen species. Now we can't get away from all ROSs, nor do we want to. They're important, but we have an abundance, maybe too many. But with that being said, blue light therapy is more for acne. Now, should we be using red light therapy on our face, on our arms? I flip-flop on this too. And right now, especially in the summertime, I would never put an LED mask. I don't wear the mask in the summertime. Why? Because my face is already exposed to the sunlight, which has infrared light, it's got UV light, it's got visible light, it's got like electromagnetic light, or waves, radiation. So all of the things, our arms and our face are already exposed. So I'm not gonna overdose with infrared light. And if you wanna put it on your legs or on your chest, if it's not getting sunlight, then maybe that's the way to go, okay? But right now in the summertime, or if you're somebody like me who's outside, I'm outside all the time. And there's no reason to take in more infrared light or near infrared light. Okay, that, hopefully that explains a little bit, but again, I would caution you, your skin condition is not deficient in LED light. So with that being said, it seems obvious that LED light over time is not going to treat your symptoms. Your symptoms are a symptom of something else. The LED light is not treating the root cause, which I know it sounds like a broken record, but it goes back to your diet. Whatever you're eating is causing inflammation in your body. In fact, anytime we eat, there is some amount of inflammation that is going on. There's some amount that's going on. Because eating a foreign body will cause irritation or inflammation, or both, okay? I took notes, so that's why I'm talking about this. But sometimes infrared light is maybe all you need to not cure your problem, but to reverse or to help out with the symptoms. And how does that work? It's basically increasing activity in your skin, in the cells of your skin. So it's going to increase activity. And with that being said, could you get inflammation? Yes. So some people will put an LED light mask on and get more red or more irritated. Back off. It's not from the LED light. It's from it causing or it leading to increased activity in the cells. That's why I don't believe that you have to use an LED face mask, a red light mask, on a daily basis. It's not necessary. You're just increasing activity beyond what it needs. You also have to be aware that when we're using an LED mask, there's so many on the market. And again, I do not speak to any, but you want something that is high powered. You don't want something that, basically just sitting in your face and not doing anything. There's dermatology offices that have $25,000 red light therapy, technology in their office. And that technology is upwards to, I wrote it down, 240 joules per square centimeter of energy, of power. That's huge. I think the Style Pro might have the most, for a home device, might have the most power, and it's actually the cheapest. But again, don't quote me on that. Okay. Oh, before you put if you're going to use a red light mask, please, please, please wipe off your face. Use water, whatever. Get the chemicals off that you had maybe from the night before. So all of your topicals, they can react to the radiation from the red light. So now you're causing more reactive oxygen species. So the person who gets a red face after putting on the mask, because there's no heat in it, remember, there should be no heat that's accumulating from the mask itself. So you're causing radiation, so free radicals again on your face simply from not washing off the night before. Okay. Other things, IPL, intense pulse light. Again, they're treating symptoms. Your problems are not from a deficiency of IPL. I don't know enough about it to speak to it in any other fashion, but just hear me out there. Another one is people who go get hydrofacials, basically a glorified shower on your face. It's your money, but I probably would not, I probably would not waste my money on it. But you might say, well, gosh, my face feels so smooth and so, it looks glowing. Well, that glow is redness. That redness is inflammation. Again, I think it's rubbish. Okay, the next one, exfoliation, either chemical or like using a washcloth, or even really hydrofacials. Anytime you exfoliate, you're taking a layer of skin off. Okay, I'm not saying it's a bad thing because we have dead, dying cells on our skin, but simply using a washcloth on your face causes a physical irritation. It's a physical exfoliating agent. And you might rub harder here than you do over here. You might use the same hand. You might be left-handed. You're doing really well here, but you're not going to do as well over here, up here. But you're getting uneven terrain on your face. And so I caution you to be very careful with using physical exfoliants. I also want you to be careful using chemical exfoliants. Anytime you use a chemical exfoliant, that is an acid, whether it's an AHA, like glycolic acid, or a BHA, like salicylic acid. Remember, BHAs or salicylic acid is lipid loving, right? It's hydrophobic. Salicylic acid is much better for your acne, whereas glycolic acid, an AHA, might be better for your aging skin. Do you do it on a regular basis? No, you might do it twice a week. You might do it once a week. But when we get that dull skin layer off, you are bringing out, people say, well, your face glows, or you have a nice glow to your skin. That is a sign of health, or, some people would say less aging potential. But again, no amount of exfoliation. No, you can keep taking the layers off your skin, but why is your skin in a bad place in the first place? Again, I go back to diet. All right. Microneedling, I don't suggest doing that for eczemas or acnes or psoriasis, anything like that. I think if you've gotten over your acne, maybe microneedling might be in your best interest. But honestly, I truly believe that you're causing a bunch of irritation, and you doing it at home, again, that's another thing. I would recommend that you have a professional do it if they're going to do it. It's something that you have to look into. I'm actually no expert, but again, I'm just speaking to these devices because we have used them to treat skin conditions in hopes that we won't get them back. And we usually do. 6 months down the road, you got your rash back, or you got your acne back, or your rosacea back, because you're not treating the underlying cause of why you got a skin condition. All right, injectables. I could talk all day long about injectables. Botox, but that's a brand name, botulinum toxin. Toxin. It's a toxin. It ceases movement in your skin. So it's a toxin that stops movement. So people, when I raise my eyebrows, I am going to get natural lines wherever, where those are the dynamic movements of my face. So if I'm raising just my left eyebrow, I'm going to get dynamic lines, okay? Fortunately, mine do not show as much as other people, but again, I think it's from taking care of my skin and eating a high protein or a moderate amount of protein and high fat diet. I truly believe that how I treat my insides is going to reflect on the outside. So no amount of red light therapy, no amount of microneedling, no amount of AHA or BHA, no amount of dermal fillers, which is basically just a glorified hyaluronic acid. Do really volumizing me? No. I mean, hyaluronic acid, especially topical. I mean, yes, I understand that when you inject fillers, you're going deeper, but the hyaluronic acid isn't preserving or causing any more volume from water. Water comes from inside you. No amount of hyaluronic acid I put on topically is going to cause more water to be more hydration. It doesn't cause hydration. It might seal it in, but it's not going to cause it to accumulate under the skin, okay? I'm not saying don't use hyaluronic acid. I'm just telling you that, again, all these things are glorified, and we start looking into, how much do we really need to do? Looking into the forms of cross-linking of hyaluronic acid is going to be very confusing for many people. One more thing on Botox that I don't think people quite understand, but yet they understand, because we use Botox for sweating in your axilla. What is Botox actually doing as a toxin? Well, it's actually blocking sebaceous glands. It's blocking sebum. So over time, you're blocking, if you're doing micro amounts of Botox all over your face, your sebaceous glands, your sebum production goes down. You might think this is a great thing, but over time, 6 years from now, 10 years from now, no sebum production. I think we need to, look to the future. If your sebum and your elastin, which Botox also affects, is down because you've prevented it from working, I'm trying to build up my elastin and my collagen in my skin, not break it down even more, just because I don't want wrinkles on my forehead when I raise my eyebrows. But you guys have to decide. The owner of the body has to decide what they're going to do with their face. Skin boosters, again, wow. I mean, how many are there? If you have money to spend and you enjoy these kind of things, do the skin boosters. But I think water as a cleanser, or maybe even a cleanser once a day to start out, would help. It just depends on what type of skincare you have, or what type of skin you have. Are you an oily skin? Simply trying to block oil production on your skin. You say, oh my gosh, I'm just so an oily person, so I'm going to just keep blocking oil. You're actually going to start making more. So you've made your problem even worse. So I have patients who say, I have the oiliest skin. And so they'll get cleansers that are for oily skin, and they'll get done, and their skin feels tight and dry. They've actually made their problem worse because they'll produce more oil to lubricate it. All right. Okay. Let me make sure I'm not missing any questions. Good. Retinoids. This is probably one of the topics that I go back and forth on the most. And why I say that is I probably started retinoids maybe about 3 years ago. And each year I learn more and more and more. Many people will try to put a high strength retinoid on their skin, and it only causes problems. It causes more redness, because that's what retinoids do. and more irritation and more inflammation. Retinoids are vitamin A derivatives. An ester, a retinol ester, is probably the calmest, tamest of the retinoids. It is mild. It's in a lot of skin care products. Tretinoin, or retinoic acid, is by prescription only, and it's the highest concentration. If you were to go out in a crystal ball 5 years out from right now, and a person who used a retinol ester versus a person who used retinoic acid, tretinoin, their outcome is going to be the exact same as far as skin look. But vitamin A toxicity might be much higher in the person who used retinoic acid, tretinoin. Do we want all that retin A? Can we get toxicity of retin A? That's another topic that I've been diving into. Is it possible? Do you want to be taking retin A and applying it to your face and eating organ meats like liver? Probably not. You have enough vitamin A. Doctors who prescribe you retinoids are not going to ask you, hey, are you eating liver every single day? Are you eating organ meats? Because you might not want to take these things. The most powerful one that we prescribe to people, which is beyond my comprehension, is Accutane. Why would anybody do that to their child? Usually, most parents, they see their kids suffering from acne. Let's put them on Accutane. What a mistake! It's something underlying, you guys. You just don't have acne. You have a hormonal imbalance, and that imbalance is from something else, and it's usually your diet. And I can go back to lectins, and I can go through, seed oils or sugars and glycation and all of these things. But before you put something on your face or you put something in your mouth, you need to know what the ramifications are. That's where informed consent comes in. And doctors are not giving you informed consent. They just prescribe. And then they say, go back to your family practice doctor because you really need to check your liver function and your cholesterol because it can throw off your triglycerides and raise your LDL. And it can cause liver toxicity because most of your vitamin A, about 92% of it, is stored in your liver. And if you have too much and you're causing toxicity, what organ is going to be toxic? A liver. And then if you're eating a bunch of seed oils, where's the toxicity? Liver. What about sugar? Liver. You're overdosing your liver. And you wonder why people are getting fibrotic liver, fibrosis, leading to cirrhosis, leading possibly to liver cancer, hepatic cancer. We're not thinking through everything, you guys. And that's why I do what I do. I love to, I love doing these live sessions and answering your questions, okay? Carla asks, what about going to a dermatologist and getting hair removal from chin, or is that going to hurt my skin permanently? It takes about 1 year to get it removal. I'm not sure what you're saying. It depends on what they're using. I'm guessing they're using laser therapy. You just need to know, I don't know what laser therapy they're using for hair removal. I would have to look into it, Carla. I don't know the answer to that, but one thing I do want to mention is anytime that we use any type of laser, whether it be intense pulse light or any other type of laser, we have to be careful with our fat pads because the fat pads are also being destroyed. And for somebody like me, I might not want to do those type of therapies because I already, from dieting, from being a bodybuilder, I already have no fat pads in my face. They've been broken down, or they've been defeated. And we want fat pads. That's what gives your youth look. Your fat pads in your cheeks. Right here, can you guys see the shadowing in my temporal area? That is from no fat pads. That's from a loss of fat pads in my temporal area. We have fat pads all over your face. You have maxillary ones, you have mandibular ones, you have temporal ones. Look them up. But once you lose those fat pads, there's not much that can gain them back. No matter how much you eat, you're not going to likely develop more fat pads in your face. So I didn't know all those things. I'm good with the shape of my face, but you know, if somebody comes up and only sees from, say, my collarbones up, they might say I look sick. Well, you know, if they look from my collarbones down, they say, well, she looks pretty normal because of fat pad, where they're at, where they're not at. Okay? So we have to be good with the things that we've done in our past. And I don't have any regrets in regards to bodybuilding, that's for sure. I enjoyed it. It was a fun time, you know, in my life. Marne has a question in regards to hormone therapy and growth hormones impacting teens. This is a topic that is, you know, very controversial. And I would hope that when a parent goes and give their kid hormone therapy or growth hormone, that there's an actual diagnosis or an actual need. You know, are we going and doing stuff because we don't like the look of our kid? They're not tall enough, they're not this, so we're going to give our kid growth hormone or steroidal hormones in order for them to grow bigger, faster, stronger. There's so many things that go into this. But once you give these things, especially for males, you're actually shutting down their normal hormone production. You're shutting down their testicles. And many times those testicles won't come back. They won't start producing testosterone. So now that kid has to be on steroids forever, or else their normal production might be in the 200s, but a normal 20 or a 17, 18-year-old kid, their numbers could be 1,000. But if we give, you know, steroid hormones to kids in young age, we're basically shutting down their normal production forever. I have high school kids that I used to see, and they're on steroids for football. And I've been in practice for 27 years, so you know, you take 27 plus 17 that I've been seeing them, and these guys are in their 40s and been on steroids for their entire life because there's no going back. Now, with that being said, what is going on with the kid? If the kid was fat, the high insulin that's causing the fat will cause aromatization of testosterone to estrogens. So giving them more testosterone isn't the answer. You're causing more and more aromatization, which is more estrogenic. Now you're going to cause female features, gynecomastia, these things, weeping, crying, emotional stuff that come along with women and estrogen. So unless there is a really, really good reason, a diagnosis, I would not give kids hormones or growth hormones. Carla says, my daughter Missy uses Accutane. Well, okay. Okay, let's make sure I didn't miss anything. I talked about the retinoids. Starting slow, going, maybe you don't even need a retinoid. I don't know, but I'm just saying that maybe for you, just an ester would be fine. Like from Inky List or The Ordinary or something like this. Those two brands are pretty good. And so maybe just starting with an ester is fine. The aldehyde is probably the last step before you get to tretinoic acid or retinoic acid, tretinoin, any type of retinaldehyde. So it goes ester, then retinol, then retinaldehyde, okay? Then tretinoin, Accutane. Oof. Okay. Marnie says, this is so sad. My poor nephew, he was on a med that made him chubby, now on hormones because he wasn't growing. Great. So now you know, Marnie, the consequences of us not having informed consent. So you go on a med, a psych med, for instance, and it increases our appetite. Our appetite, because we chase neurochemicals in our brain, we're always chasing neurochemicals. It's just the way our brain is or our body's hardwired. And one of those is dopamine. And we will start consuming things that increase dopamine. That, in most instances, is a type of food. That type of food is carbohydrates that are processed. They are very palatable. And the people who make these foods do things in a lab to make them hyper palatable. So now you gave your family member, your friend, whoever, or the doctor gives it to the patient, not giving informed consent. No informed consent of what this could do. You never once talk about their diet. You never once tell them that they're going to gain weight. You never once tell them that the foods that they're going to choose are going to cause high insulin. High insulin is going to lay down fat. And then their normal production and their hormones are going to be disturbed. You never once told them that. You just wanted to prevent them from some depression. Well, what was causing the depression? Your depression is not a lack of Prozac or a lack of Zoloft or whatever the medication is. It's not a deficiency. So you just go and give a medicine because your kid is depressed? What's the underlying cause? Did you just take that kid to counseling first before you decided, informed consent, I'm going to put the kid on medicine, which is going to make him chubby, which is going to make him his hormones off balance. Then you're going to give him hormones and cause more problems? I mean, it is a tumbleweed. Now you've created a monster simply because maybe their depression was something else. Maybe it was from diet in the first place. Maybe they're being picked out in school. Get to the heart of the matter. Don't just rush to medications. I'm sure that there is a time and a place for medications. But honestly, you guys, we need to think through everything before we go and do that, especially to our kids. They don't know. They don't know. Right, Lisa says growth hormones are used to assist Turner syndrome in order to grow. That is a diagnosis. It's a diagnosis that could possibly benefit from taking some growth hormone under medical supervision. Yeah, sooner. Lots of problems with counseling. I get it. I understand. It uncovers a lot of, or peels back a lot of layers on the onion. That is for sure. And we just need to have informed consent before we go and take something, okay? So I kind of finish up on the skin topicals, and the other one is vitamin B3, which maybe some studies have shown that it could possibly take the place of retinoic acid or retinoids because of the irritation that retinoids cause. It might be that we maybe shy away from retinoids. Maybe vitamin B3 could be an option, which is, you might know it as niacinamide or nicotinic acid or niacin. But B3, because it helps with the mitochondria inside your cell become more active, producing more ATP, some studies have shown, my friend Peter would probably be wanting to put a bag over my mouth right now by mentioning vitamin B3, because he doesn't maybe believe that we should be disturbing natural production. And I'm on board with this. Natural physiologic and biologic processes in our body that actually have B3. Is it a cofactor? Yes. Do we get it from our food? Yes. We're not eating very good. That's why people are taking vitamins and supplements. Supplements means supplementing a diet that is nutrient deficient. But what about something like Peter sells glucarin? Well, glucarin is a nutraceutical. The person should be in their diet is fine. So it's actually, a nutraceutical is actually a bonus. And a bonus that works with normal biologic and physiologic processes. It's not blocking things or going in and inserting itself in a normal cascade in our body. It's actually promoting a natural cascade in our body instead of, let me give you an example. Let me give you an example of vitamin C. Another topical that I flip-flop on. And maybe my flop is already, it'll be forever. Vitamin C is very important for us. Vitamin C helps collagen and elastin production. So when we apply it topically in the correct form, we help with collagen and elastin. When we take it orally, we help with elastin and collagen. The reason people need vitamin C is if they're eating a high carbohydrate diet. So a person who's eating a Western diet is going to need more vitamin C than somebody who's eating a lion diet or a carnivore diet or even a keto carnivore diet. They need less vitamin C because they're not eating carbs. The carbs, sugar, actually sits on the same receptor as the vitamin C. So it's going to take more and more vitamin C to hit the receptor, knock the sugar off. Vitamin C need is maybe about 15 milligrams. Yet we are getting doses of 5,000 milligrams. Well, I guess I could see that in a person who's sick all the time, they're overweight, they're eating crappy diets, they're going to need vitamin C because they're not getting it. Now, back to a topical vitamin C, which we used to use ascorbic acid. Vitamin C is ascorbate. So ascorbic acid is very unstable when it comes to being topical. Because the minute you open a container of vitamin C, ascorbic acid, once it hits the air, it becomes, I don't want to, rancid, or it produces free radicals. So it's become null and void. So that's why they started selling vitamin C in a pump. So it never is exposed to light. So if the vitamin C ascorbic acid sits in your cupboard at room temperature, not too hot, not too cool, the shelf life is a little longer. But by the time you're buying it off a shelf, it might already be 6 months old. So what is a better option than using an ascorbic acid at 10% or 20%, which we should probably never go that high anyway, would be THD. So tetrahexadecyl ascorbate. So THD little a. And that is actually more stable and helps as a vitamin C for your face much better than ascorbic acid. So for those of you out there who are using a vitamin C in your morning routine and it's ascorbic acid, and you might have bought like the Timeless brand because it's in a nice pump, and you might have bought the 5 or the 10% and you're doing all right, maybe the next time you switch over to the THD ascorbate. And a brand, the one I lean to, I don't work for anybody, okay? I just, I looked at the product. It's by Pillow Talk Derm, Dr. Idris, Idriss, Pillow Talk Derm. She's out of New York, and she has a product. It's a moisture cream, but it has THD in it. You can use it twice a day. Many people will just simply use it in the morning in their morning routine. But it comes in a pump and a little pink. Her colors are lavender, so it comes in a lavender pump. And it's not exposed to the air. You should not open the jar unless it's at the very end when you're trying to get the last amounts out. But it comes in a nice pump. It doesn't take very much to use. Lasts for a while. It is quite expensive. I believe it's right around $58. But it's going to last you a month or more, depending. You don't want to waste it. But if you're putting on your face and your neck and maybe your décolleté, you're going to go through it in 30 days. I don't know of any other brands that have there's one, something Goose. I can't think of it. You're looking at $175 for their product. So it can, I don't know if the amount of money spending makes it any better. I don't know. All right. So ascorbic acid, I would probably try to avoid. Vitamin C, my thought is go carnivore. You don't need any vitamin C. Most people they think they need vitamin C for their immune system. Those people are getting sick because their crappy diet. Okay. And they do need supplements because their diet is deficient. That's why they need supplements to supplement a crapola diet. And they are the people who are getting sick. If you look back at the people who got COVID, yeah, those are the people who had obesity, they had diabetes, they had low vitamin D. These are the people who are affected. They had iron overload. Everybody has iron overload unless you're treating for it. Everybody, especially those who were bottle fed. You started out on formula to start your life out. You were overloaded from day one, and you've lived with it until you start getting symptoms. Those symptoms can be your skin, they could be your joints, they could be your liver, your kidney, your heart, your eyeballs. I had a lady tell me the other day that she used to have these like copper colored spots in her eyes, and she was told it was copper. And she started glucoferrin, and she was at a family reunion or something like that. And her family told her that her eyes looked bluer. And she noticed that the copper looking spots were gone, which I'm guessing was iron, but it doesn't always. The glucoferrin is a chelator for all heavy metals, iron especially. So iron overload in the form of non-heme iron is something that, yes, it could be a buzzword right now, but it's something that is, whoa, blows your mind. So you people who are getting infections all the time, I would consider taking glucoferrin. They are sulfur bonded amino acids. Anybody who's got iron overload is high risk for infections. There was a recent, I think it was around February or March. I don't quote me on the times, but maybe it was early part of 2025 or late 2024. There was an outbreak of tuberculosis in Kansas, maybe. When you go look up studies, like you go to when you go look up studies that are out in the public, what is that site? Gosh. It's a public domain that you can look up sites. Okay. There are studies on tuberculosis and iron overload and how it causes tuberculosis to like grow out of control. And if you have iron overload, you are more susceptible to tuberculosis. But it might not just be tuberculosis. It could be COVID. It could be flu. It could be strep throat. It could be any bacteria, virus, or parasite, or fungal infection. Iron overload. Think about all of the diseases that people are getting. You know what we're checking? We're checking your immune globulins, your games, IgG, IgA, IgM, IgE. We're checking all those things, but we're not checking iron studies. Crazy. So Sooner says free iron in the blood, at least associated with breast cancer. Well, is it free iron that's in the blood or is it in the breast, Sooner? So it's usually the iron that's been bound up, locked in the cells. It's not free iron. That free iron, again, it's becoming released, causing free iron, but we want heme iron. Our body will not run without iron. It is very important. So people who are on PPIs, like proton pump inhibitors for heartburn, why do they have heartburn? Right, but we'll just give a medicine. Doctor, you're just going to give a medicine, you're not going to talk about what's causing it? That's what doctors do, right? They just give medicines. So if you take a PPI, it changes the pH. There's a lot of things we ingest that changes the pH of your stomach. Our stomach is meant to be acidic. Making it alkaline decreases the absorption of iron, especially heme iron. It decreases absorption of magnesium and calcium and zinc and selenium and B vitamins and amino acids. So we're causing a lot of problems. PubMed, thank you, Ruth. I couldn't think of it. So PubMed, just go look up studies with iron and tuberculosis. Craziness. But yeah, the more and more I learn about, Janet says, are you having good experience with glucoferrin? Again, what is that experience? If you're someone who is relatively healthy, I consider myself relatively healthy. I eat a carnivore diet. I exercise on a daily basis. I get out in the sunshine. I pray. I stay away from heavy metals. I don't get around pollution. I don't smoke. I don't drink. I don't do a lot of the things that people are exposing themselves to. So will glucoferrin will I have noticeable effects? Maybe not right now, but maybe in 10 or 15 years. What if both of my parents have Parkinson's disease and I'm one that does not get Parkinson's disease? What if I don't get infections in the future? What if I go the rest of my life, 120 years, by the way, because my telomeres tell me I can live 120 days, and I don't shorten them. I'm not shortening my telomeres. I'm allowing them to stay the length they are. I'm trying to stay healthy. I'm doing the best I can. Is glucoferrin going to be a bonus? Absolutely. Nutraceuticals are going to be a bonus. Will I notice it? Maybe not. I have seen people notice it though. Those are the sick people. My testosterone patients are the ones that notice it the most. It's unbelievable how much they notice it. And then when I check their iron studies again, it's incredible what has happened to their labs in a positive. So, everybody's gonna, it is, it's just another, I don't want to say a supplement because it's not a supplement, it's a nutraceutical. A supplement is a supplement. A nutraceutical is a bonus. If we have genetic problems and we have the ability to change those genetic problems by taking a nutraceutical, and there's no harm in taking that nutraceutical, maybe taking the nutraceutical would be in your best interest. If I want to bypass that genetic defect, I'm not going to turn on the epigenetic switch. I'm not going to do what my parents did. For instance, my mom never really paid attention to diet. Never really. She just ate whatever. She drank soda, didn't drink alcohol. She did smoke for a while. Did all those nasty things, maybe still does. Is glucarin going to be as successful in her as it is in somebody like myself? Maybe not. Did my dad, could he have benefited from glucarin? He did exactly what the doctors told him to do. My dad was a runner. My dad, which in and of itself is probably a bad thing. And I tried to say my dad was healthy, but he did all the things that they told him to do. Exercise every single day, burnt to the point of burnout. Don't eat meat. My dad, we always used to eat meat in our house. And then we switched to chicken. And then it was basically beans and rice and maybe very little chicken. So we're turning into little vegans in our house. Then what happens? Coronary artery disease. Did it cause it? My dad wasn't going to have a heart attack, but his heart was not working very well. He went into VFib or VTAC. I can't remember which one it is at this point. But so many things we were told to do is causing our demise. And so my passion is maybe less is better. Maybe just eat, carnivore diet, eat beef and butter and bacon and eggs and call it good. I would try to get organic grass-fed versions of those. I mean, we do want to try to keep the amount of omega-6 polyunsaturated fatty acids as low as possible. Do we need them? Absolutely. They're an essential fatty acid. We need omega-3. We need omega-6. But we're getting omega-6 in a 20-to-1 ratio to omega-3s. It should be 1-to-1. So you know what you guys will do? Take more omega-3. Eat your crap and take more omega-3. So you're taking more rancid omega-3s just to try to keep up with the amount of omega-6 that you choose to eat. Chasing the lust. You continue to eat omega-6s, which are in processed foods, linoleic acid, and you're getting the consequences of doing that, which is disease, along with the iron overload, non-heme iron overload, along with the heavy metals that we're exposed to, and the water. It all adds up. If you're okay with that and you've lived a great life and you're skipping and dancing and singing the happy song down the sidewalk, great. But if you're somebody who's sitting back and you can't understand why you're tired, why you're getting sick all the time, why you have so many diseases, why the doctor keeps putting you on medications, maybe you need to start peeling back the layers and saying, what am I doing wrong? So Janet, I don't know if that answered your question. I'm not going to stop the glucarin if that answers it. I will continue to check my labs. I will see where my iron is at. But if I have a genetic defect at number 456 amino acid, and I can take an amino acid supplement in the form of glucarin that will bypass that, I don't know. As long as I can afford it, And just to kind of piggyback on what Sooner said about iron being a higher risk or being found in breast cancers, it's in all cancers. All cancers are going to be a result of iron overload. Iron overload, remember, causes the growth of, if somebody says, no, it's parasites. Well, what do parasites feed on besides sugar? Iron. So which one causes which? Are you just feeding it? Everything's living rent-free in your body right now. You either turn off the spigot or keep it going. So parasites, fungus, bacteria, viruses, iron. It's a food source. Sugar, it's a food source. Are you going to turn off the spigot or keep it going? Sooner, you got a lot of information in here. I think you're just trying to give information rather than instead of asking a question. If you're asking a question, put a Q in front of it. Marnie says, I have a friend that does triathlons and eats clean. I don't know what clean means. Does that mean washing it off with soap and water? I don't know. But has recently developed diabetes. She has fat around her belly. She can't figure it out. It's too bad. So what's going on, Marnie? You've listened to me long enough. You know what's going on. El Rosario asks, I got high cholesterol. I'm on a carnivore diet. The UK standard is 5.2. I don't know what 5.2 is. I'm guessing that's right around American 160, but don't quote me on that. I think that you're putting too much emphasis on cholesterol. Personally, I do not believe that LDL and cholesterol are the cause of coronary artery disease. I think you need to look at, Rosario, I think you need to be looking at your triglyceride level and your HDL level. If your triglyceride levels are high and your HDL is low, you are a metabolic mess and you're at high risk of a myocardial infarction, a heart attack. This person that Marnie's describing, she's a triathlon. These are the people that go run long distances, they eat whatever they want. These are the people that think they can just eat whatever they want, burn it off, run triathlons, and the foods that they're eating is the foods of their lust. And it's usually carbohydrates because they're chasing neurotransmitters, dopamine. Susan says, can you take glucarin if you take diabetes? Absolutely. You'll probably end up taking less diabetes medications if you take glucarin. And I should mention that glucarin, I would not buy it from Amazon. I would either buy it from the seller of glucarin. So the patented glucarin, which is glucarin.com, or Metabolism IQ sells it, or Baker Family Fitness sells it if you're in Canada, Baker Family Fitness, or Metabolism IQ in the United States, or simply glucarin.com. They will ship across seas. But yeah, I think it would be worthwhile. You're from, Harps is from England. Where are you from? You might have just joined in. I am from Iowa in the United States. Okay. You're very welcome, Susan. Thanks for joining over there on YouTube. I appreciate it. So, Marnie, the eat clean, which would be, I'm guessing, if I were to guess, this person is eating some fruits and vegetables and some lean meats and eating energy bars and doing the thing during their triathlons and eating a bunch of sugar, but they think that they can process it. They get diabetes. Their mTOR is high. Their insulin is high. They're causing a lot of problems. They got fat around their belly, which is usually liver fat. And they're getting fibrosis, and they're getting cirrhosis, and they're going to get liver cancer, and on and on and on and on. We need mTOR. You need cell growth, but you need a shut-off switch too. And that is autophagy. And you can only get autophagy from fasting, not eating, or being in a ketogenic diet full-time. Janet says, it was a super lesson. Thank you. This was a great question. Worker says, I'm curious about why glucarin and not lactoferrin. Perfect question. I love this question. You are an educated person, and I appreciate that. Lactoferrin actually has iron in it. So lactoferrin is natural breast milk. And the first part of the breast milk that comes out is called colostrum. And then lactoferrin is secreted after that. And then the lactoferrin that comes from breast milk is containing of iron. So Glucoferrin is apolilactoferrin. APO, lactoferrin. The iron's been removed. Great question. So if I'm wanting glucoferrin to work, I don't want to be adding more lactoferrin, colostrum, all of these things that have iron in them. I want to take something that's going to, apolilactoferrin also in the glucoferrin has chromium in it, trivalent chromium, 3+, not 6+, not 4+, 3+, 3+ chromium, trivalent chromium. That is actually a binder, a chelator, and a sequester of heavy metals, namely iron, namely that which has been built up in our tissues. Okay, so that's why maybe not taking lactoferrin. So many studies are being done on lactoferrin and like anti-aging, and I'm hearing you. I hear you. I just maybe would think about taking glucoferrin. Okay. Marne says, I've told friends about being keto and carnivore, and some just don't think it's healthy. All I can do is share and demonstrate what it's doing for me. Exactly. I don't know if you were here yesterday, Marne, but you need to picture a person about your age who has a glass full of water, and that water represents all of their experiences. And because we've been slambasted with things that tell us that red meat and eggs and cholesterol and saturated fats are bad for us, they got their blinders on. And until they start dumping out some of their experiences, they're not going to be able to accumulate any of your experiences, no matter what you do. So yes, it's best to just reflect what the diet has done for you. Is it reversed things? Is it, improved your skin? Is it improved your brain function? Is it improved your livelihood, your sleeping? I think anybody who takes glucoferrin should actually be on a carnivore diet. Why settle by taking glucoferrin and not changing your diet? It's kind of like treating your acne. Why put something topically or do a red light mask or a blue light mask or whatever the mask is, or do boosters or whatever it is, and not fix your diet? It's almost like you're kindling the fire as you're trying to put it out with water. And that's why I try to get through to people that they need to fix what's going on inside. And what's inside is coming out. And we need to fix that. I believe number one is with diet. Number two, and then after that, it's sunlight. It's clean water that, not tap water, not city water. It's getting out in the sunlight and nature. It's clean air. It's standing barefoot on the ground. There's all these things. Avoid smoking, avoid drinking. You mean forever? But that's up to you. That's up to you. You mean carnivore forever? Again, that's up to you. Do I eat the same things every single day? Yes. Is it satisfying? Yes. Is it pleasurable? Yes. Is it helping me? Absolutely. Does everybody have to do it? Nope. You don't. I don't want to force my diet on anybody. I just want to tell you the ramifications of other diets. I want to tell you the benefits of this diet. I also want to tell you the ramifications of this diet. If you're eating just protein, you're going to have a problem. You need fat. You need fat. You might need more fat than you need of protein. The fat is very important. The cholesterol is very important. Marnie's nephew probably was on a low-fat diet, eating a sugar diet. Low protein, low fat, and you expect the kid's brain to develop? You already messed it up in utero. The kid should have never been sitting for 24 hours in the pelvis trying to deliver him. You do an emergency C-section. You don't just keep pushing out a baby's head through a pelvis that is not allowing it. You go to surgery. You get the kid out. You save the kid. And now we've caused traumatic brain damage. But nobody ever thought hey, how can I fix that? Fat? How can I fix his brain? How can I get it going? His brain made of fat. Nobody gave him any fat. Nobody gave him MCT. Nobody gave him any saturated fat. They didn't give him any animals. They gave him vegan. They gave him fruits and vegetables because there was vitamins in it and phytonutrients. Not true. They're blocked by their anti-nutrients. So you're eating a bunch of anti-nutrients, trying to get a bunch of what you think is good for you nutrients. And they're made in a lab. And they got more sugar and fructose in them than they would have ever had with our ancestors. So you have to think through these things, okay? Worker says, thank you for your answer. You're very welcome. Carlos says, this is very good information. You're very welcome. You're very welcome. I talked about the importance of fats and why to maybe choose grass-fed over the alternative. I want to clarify something. If you cannot afford organic or grass-fed animal meats or eggs, get the best thing that you can afford. It's great. It's still great. You're worried about hormones? Don't be. They're in and out of that animal system. What you do want to avoid is, and maybe not so much in ruminant meats like cow, deer, bison, buffalo, sheep, lamb, they're polygastric. They have a polygastric stomach, so they're able to deal with the plants better than like a chicken or a turkey or a pig, because they're monogastric animals. That's why I wouldn't put those things in my body, because we're monogastric. We can't deal with them. We cannot break them down. You might think that you're breaking down your plants, but you're not. It's not you. It's the microbiome that's in your body that's actually breaking them down. So you're feeding a bunch of bacteria in your bowels. They're living rent-free, and they will continue to live rent-free depending on what you feed them. So whatever we eat, we will grow bacteria that eat those things. If we eat things that cannot be broken down, like plants, we have no ability to break down plants. We do not produce a cellulase enzyme that breaks down cellulose. Plants have cellulose. We don't have cellulase. Cows do. The biome does. There's no nutritional value. The bugs are living rent-free, and the rest comes out as waste. That's called a bowel movement. People who are carnivore don't have much of a bowel movement because they have no waste. They have almost 95 to 99% absorbed in the small intestine, not the large intestine. So they're getting a very nutrient-rich diet, those who are eating carnivore. If you've been eating a westernized crapola diet, would you just go to a carnivore diet tomorrow? Maybe, likely not. And maybe it's one of the reasons why you fail in the first couple of weeks, because your microbiome was eating crapola. And now the new bacteria need to grow up, and those bacteria are going to eat carnivore foods. And so if you do it tomorrow without giving like maybe kind of a transition into a carnivore diet for the bacteria to switch over, it takes about 2 weeks. It takes 2 weeks for your bacteria in your gut to, there's a great name, dog lover, 26695. I like that. Dog lover, welcome. I don't know if I've ever seen you here before, but I do this every Saturday and Sunday. Saturday, 9 a.m. Central, Sunday, 10 a.m. Central. If you want to hire me in a consultation to go over labs, that would be awesome. You can contact me via email at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Marne says, I went to animal-based carnivore too quickly. I think I'm still getting used to it. I spent so many years doing low fat and no red meat. Yeah, that's a problem. And Marne, it takes a while for your gallbladder to wake up, because you were low fat, so your gallbladder was not contracting. And so bile acids will build up. Bile will build up in your gallbladder, can cause a sludge or even gallstones. And then when we switch over to eating more fat, the gallbladder wall is going to start contracting. It's waking up from hibernation. And then it's going to try to push that sludge out through the duct or the gallstone. And that's going to cause some pain. So for people who, have been eating a low-fat diet, have been eating mainly a plant-based diet, you want to go slow. Okay. Hello, Ed. Thanks for joining. Those are good questions, you guys. And one more thing about sharing stuff with your friends and family. Sometimes those are the hardest people to share things with. Maybe, the people who are around you the most, that is sometimes the most difficult. And a lot of times, jealousy plays a role. They see you being very healthy. They see you doing, things that they wish they could do. And a part of their resistance might be that they're jealous. And we have to be very careful and be sensitive to their emotions as well. And let them ask questions. Instead of just offering up, it's natural just to offer up, advice to people, but they may not be ready. Yeah. Not ready. I'm going through reading questions and seeing if there's any. Oh, that's okay, Ed. I'm just glad you're here. He said he's joining late. Okay. Let's see. Okay. You guys, I think the questions have about ended over here. If you can like and, hi Brenda, if you can like and share, that's how it helps me. If something I'm saying today is helping you and you think it can help somebody else, maybe it's a friend or family, let me do the talking to them. So instead of Marne doing the talking to her friends, family, coworkers, just pass on something. So, if they ask a question like, why do you do what you do? And you say, hey, why don't you listen to Dr. Jensen's reels? Or she's live on Saturday and Sunday. Why don't you ask questions? Just something as simple as that. Share the good news. All right? So with that being said, I will let you guys go. Happy Sunday, you guys. See ya. You Instagrammers, thanks for being so polite. I really appreciate it. If you guys are over on YouTube, be prepared. It's something. Anyway, you guys have a great day. See ya.